So we like to adopt best practices, and what we have been encouraged to adopt is the best practice of always including a patient story. Now, we've tried this across our different university best practices in California. We have one in Los Angeles, one in San Diego, one here. And our patient today, I think, is going to blow your mind, because he is not your average patient. He's a Silicon Valley genius who just happened to become a complex patient. And he just happened to take his patient experience and turn it into something really amazing that can help other patients. So with that, I'd like to introduce Justus Decher, and I'd like to ask Chad to please load up his slides. Justus, thank you for making the trip across the country.
Thank you very much. Wow, it reminds me of something that President Johnson said. He said, "I wish my mother and father were here today to hear this. One, that my father would have enjoyed it, and my mother would have believed it." So thank you very much. Well, this is really unique. Thank you, Hattie Hanley, and the Right Care Initiative, as well as the Department of Managed Healthcare and the Sierra Health Foundation for asking me to speak today. And thank you, all of you guests, many of you whom I've had an opportunity to meet coming in. Thank you very much for the warm welcome. Today I'm here to present the patient perspective of the complex patient, or as when I was going through this last night with my wife, who's a very, very close advisor to me, she said, "Don't you mean high maintenance?" So we're going to go through these subjects here and the table of contents. And I'd like to go on and make a couple introductions, if I may. This is the professional me. I spent 25 years in Silicon Valley, where I ran a think tank and design firm, and we designed 65 stents for 35 major medical companies, ISDs, VSDs, healing septal occluders. And we designed the U.S. Army Land Warrior System, which was a new American digitalized fighting first wearable computers. I was also responsible for the first NASDAQ merger post 9/11, and I'd like to continue on and give you my second introduction, my patient introduction. I'm Justus Decher, born. My date of birth is 1/15/53, so you know I just had a birthday and I'm looking forward to early retirement. I am Caucasian, German, and Native Indian heritage. I had a coronary stent in 2001 on my RCA, my right coronary artery, and it was followed by a 4-vessel CABG, which I experienced in February 22nd of 2010. I remember that quite vividly. I'm coming up on my anniversary, by the way, guys. After my bypass, I continued to have an awful lot of issues. And these were issues that, from a patient perspective, a lot of people are quiet about, but I experienced everything from costochondritis to angina to gas to panic attacks. And as you see in this narrative here, it was written by my partner, an interventional cardiologist, I had a lot of issues. And for the next 6 months, it just continued. As we all well know, necessity is the mother of invention. And this was quite relative here because I am a complex patient. On my father's side of the family, all of my aunts and uncles died at 46 from coronary artery disease. I got the special benefit on my mother's side, who was American Indian, diabetes. So this incredible combination of diabetes and coronary artery disease. I'm the typical baby boomer, and I have multiple chronic illnesses. Well, the necessity, of course, is I had no choice but to take action. I was totally engaged. I'm a technology guy. And I went out there looking to provide something, or the discovery of a set of tools that would truly be usable for people like me. This was really tough. So I looked for a solution, and all the systems I looked at were not sufficient. None of the systems were interoperable. There were just silos sitting there. So I asked myself, do I really want to take this on? Because this was really tough. And I said, is it really worth the effort? And what is the value we're going to get out of it? The patient as well as the healthcare system. I realized I couldn't live this way because, guys, I ended up in the emergency department in the next 6 months after my quadruple cabbage. I ended up in the emergency department 20 times. It was sheer pandemonium. Florence, you know. And this is, the nurses and caregivers are the ones that provided me that support and comfort when I came in, and in the next 45 minutes waiting for my troponin is to figure out whether I was having that heart attack or not. And, you know, thank you, Lord, I haven't had one. So, really important component of this is by 2030, there will be 77 million of us baby boomers out there. 77 million. We're turning 65 at a rate of 10,000 a day. And this is incredible, guys. And we have multiple chronic illnesses. What do? So then you look at the fact that a lot of the baby boomers are in rural America. And proximity to them, and proximity for them getting in for medical attention is incredible. Think of a 75-year-old grandma, Grandma Shirley, who lives in Neely, Nebraska, who goes in for a CHF, she gets discharged to home, and her family is in the urban area in only Omaha and Lincoln, that's the only urban areas around. And she gains 3 pounds in a day or 5 pounds in a week. What do? How do you know this? That slippery slope is costing us money. That slippery slope cost you guys all this money about me going into the emergency department that many times. The doctor to patient ratio is incredibly steep. And the only way to deal with this is through technology and scalability. So, measurable results and outcomes. What do I have to present here? Well, I'd like for you to look on the top left and the top right. These are my medical records from Epic. This is information that from my lipid panels and my A1Cs are embedded in the system. And underneath those, I have graphs from my solution, my product, MyVitalz. And it'll show my blood pressure and my blood sugars. If you'll see on the top left, my lipid panels since 2011 have continued to improve. Total cholesterol from 121 to 101, my HDL from 39 to 44, my LDL from 72 to 48, my triglycerides from 51 to 45. Those are astounding numbers. I think so. My first year of blood pressure measurements, I was 134 over 81 and a half. My second year, I'm at 160, 120, excuse me, I looked at the 10-minute, 126 over 69. My blood sugars in the first 6 months of this year averaged 133, and now in the second 6 months, they average 116. As you can see, my A1C levels have gone from 2011 from a 9.4 to the last year I have kept a 6.0. You know this well. And that's a struggle, guys, because I'm a diabetic, I'm 62 years old. I have to maintain this blood pressure to blood sugar ratio. That's very difficult, and you have to look out for, you know, low blood sugars. This is my company, MyVitalz, and this is what we do, from remote patient monitoring to the telehealth to mobile health apps and predictive analytics. I have here, one of the big things is that being able to monitor myself daily at home. This is what I've been able to achieve, and I'm seeing those measurable results in the best possible environment a patient can be in their home, in their comfort. And also, I've been able to, as I gather this data, I'm actually able to take and act upon that information with my doctor and my healthcare team, which is very important. Acting instead of being reactive is so much more important. As you see in my product here, I've developed a set of tools which address some of the issues in a host of healthcare complexities. Now, I'm talking to you, and I know that over the last 5 years, you guys have been inundated with changes. Some of those have been mandated, and others just because of necessity. It's a lot of stuff that you guys have gone through. My next slide, these are examples of solutions designed for myself, and they're now being used by others. From the home health side, we're dealing with 77 million baby boomers. From the telehealth side, the Veterans Administration last year had 717,000 veterans on the telehealth program with over 1.5 million touches, including mental health. This was extremely important to be able to take care of people from a widespread across the United States.
Justice, are you talking about two-way video communication?
Absolutely. 2 and 3 and 4. So you're able to take and have a veteran or an individual who, from any mobile device, tablets, Androids, Apples, platform agnostic, be able to take and call into a triage nurse and have that triage nurse determine whether you need to talk with a doctor. And I don't care where the doctor or healthcare team is, you can get a hold of them and be able to bring them into that scenario and into that conversation. It's extremely important. I do want to mention really quickly is that I will be next door between 2 and 3 o'clock. I'd like for you to stop by to see some of the characteristics of our system. I wanted to tell you one of the solutions is a mobile nurse. And this is set up and designed for disaster arenas where you might be the Red Cross and go into a disaster where you're able to take information immediately on the fly and be able to get medications and take their biometrics. But also, we've been accepted with Catholic Health Initiatives. We are initiating a program in Omaha, Nebraska at the Bergen Mercy Heart Failure Center. We're also working with Nebraska Medicine, which you know is probably one of the 4 Ebola biocontainment units in the country. They are utilizing our thermometer in the hub to be able to care for the staff and take the temperatures for the 30 days following any possible exposure. And the Mayo Clinic with the cardiovascular and transplant team, which are looking for LVADs, which is the left ventricle assist device. I want to ask you guys, you all have a different perspective on this. You have providers, your providers, your insurance companies. I want you to think about use case models where maybe you can think of something in some place that this would really be valuable and useful. I just will tell you from my perspective, you know, this gives me peace of mind. I look at this every single day. So
it helped you to manage your own care.
Certainly did. It's a meaningful use. It's because I participated in my compliance and my health care. What we're all looking for is to have that patient as engaged, not sending them home and you tell Grandma Shirley, I need you to exercise 30 minutes a day. And she comes back and says, I did, and she walked down the halls. We need to know, we need to be responsible for our own health care and not to lay all the blame or the issues on our providers. We need to be involved. That way, we can do something with it. Thank you, Abby.
Thanks for that little niblet, Justice. And for those of you who really want to see the system in action, I was pretty blown away by it. He's going to be in the Thomas room right after this is over. and show the functionality, which is, I believe it really is the future. And with that, Justus, thank you for making the trip from Nebraska.